Good evening, everyone. Today, we are going to present a small presentation on oral health education. It will be presented by my colleagues Ayushi, Bhavna, Olga, Ramandeep, Shreya, and Vishra. Next slide, please. So first, we will discuss about brushing. Next slide. Why brushing is important. Brushing is a very important step in preventing tooth decay and gum disease. Brushing removes the bacteria that promote tooth decay and the plaque that can cause gum disease. You should brush twice daily. If you are not willing to start twice a day, at the very least, brush once a day and always before you go to bed. Next slide. So we are going to discuss some symptoms of gingivitis. Gingivitis is the swollen gums. You will feel pain in the gum area, persistent bad breath, red and swollen gums, blood on your toothbrush or floss. Next slide, please. What is periodontitis? Periodontitis is the gum disease that has extended to the bony part of your mandible or the maxilla. So the symptoms that we are going to see are sore gums, loose teeth, persistent bad breath, bleeding, and it can be any time. As soon as you touch it, you can sense bleeding in your gums. Pus or bad taste from your gums, gums that appear to be pulling away from your teeth. Next slide, please. So here's a short video which we are going to present to you regarding how to brush your teeth properly.
Brushing your teeth is an essential part of your daily dental care routine, and when done properly, leads to a healthy mouth and smile. Proper brushing should take at least 2 minutes and be done twice a day. Using a soft bristled brush and a fluoride toothpaste are recommended for removing plaque from your teeth. To follow the correct brushing technique, start by tilting the brush at a 45-degree angle against the gum line. Using short, back-and-forth strokes, gently brush the outer, inner, and chewing surfaces of the teeth. When cleaning the inside surfaces of your front teeth, make sure to tilt the brush vertically and move your toothbrush in up and down strokes. Finally, make sure to gently brush your tongue to remove bacteria and help freshen your breath. Remember to replace your toothbrush when it begins to show wear, or every 3 to 4 months. You should also change your toothbrush after you have had an illness. Keeping a regular toothbrushing routine and using proper brushing technique is one of the most important things you can do to keep your teeth free of bacteria and reduce the likelihood of tooth decay.
Next slide, please. So, as we discussed, as we saw in the video, we have to keep our bristles at a 45-degree angle to the teeth, direct bristles towards the gum, and we have to do a vibratory motion 10 to 12 times and then a sweeping motion in the opposite side. Do not brush your teeth too hard. Next slide, please. Step 2, clean all the surfaces of the teeth on the cheek side, on the tongue side, as well as on the top of your teeth. Brushing takes time, so please try to brush for at least 2 to 3 minutes. Next slide. Step 4, use a soft toothbrush. There are many different types of brushes, so ask your dentist to suggest the best one for you. As recommended by Canadian Dental Association, please try to replace your brush every 3 months. Now, Bushra will give you a demo on how to brush the teeth.
Soft bristle toothbrush. Keep your bristle at 45-degree angle along the gum line. Clean your teeth with vibratory motion using light pressure. Finish it with slightly sweeping motion in opposite direction. Clean all surfaces of all teeth with the same technique in just 2 minutes. Remember to brush your teeth twice a day and change your toothbrush every 3 months.
So if you have any questions or concerns, please let us know. We are happy to assist you. Now off to flossing. Thank you.
So now we will discuss about flossing. What will happen if you don't floss? So if you're not flossing, then you are missing 1/3 of your tooth surface. Flossing removes plaque and bacteria that cannot reach within your toothbrush. Plaque is the main cause of gum disease. Plaque is an invisible bacterial film that develops on your teeth every day. Within 24 to 36 hours, plaque hardens into tartar, also called calculus. With flossing at least once a day, plaque never gets chance to harden into tartar. Now we will watch video on flossing.
Here are the 5 steps to flossing correctly to keep your mouth healthy. First, wind about 18 inches of floss around your middle fingers. Pinch the floss between your thumbs and index fingers, leaving an inch or 2. Now gently glide the floss between your teeth. Then glide it around your tooth, making the shape of the letter C. Be sure to unroll the floss to a clean section as you go. It's that easy. Don't forget to floss daily with Oral-B floss to get a complete clean. Oral-B, brush like a pro.
So here are the steps of flossing. You take a floss length equal to distance from hand to shoulder, wrap around index and middle fingers, leave 2 inches between your hand. Now slide the floss between your teeth and wrap it into a C shape around the base of the tooth and gently under the gum line. Wipe the tooth from base to the tip 2 to 3 times. Be sure to floss both sides of every tooth. Don't forget the backs of your last molars. Go to a new section of floss as it wears and picks up particles. After flossing, roll it up in a tiny ball and put it in the garbage. Never flush floss down to the toilet. Brush your teeth after you floss. It is more effective method of preventing tooth decay and gum disease. And now I will give you a demonstration on flossing. So as it was said that we have to wrap the floss around the index and the middle finger and leaving a 2 inches between the hands. Now slide the floss between your teeth and make a C shape from the base. Make a C shape and then from the base of the tooth, just gently move it towards the tip. Do it 2 to 3 times. And be sure to floss all the surfaces of all teeth. And now, while moving to the new teeth, make sure you change the floss areas because it has the food particles in it. And now make a C shape around the other tooth and gently move it from the base to the tip 2 to 3 times. This is all about flossing.
एक बात बताओगे?
Floss is boss. Flossing problems and solutions. Gums sometimes bleeds when you first begin to floss. Bleeding usually stops after a few days. If bleeding does not stop, see your dentist. Try another type of floss or dental tape. Ask your dentist or dental hygienist for advice. If your floss still shreds, see your dentist. Now over to oral cancer screening.
Okay, let's continue with oral cancer screening now. Next, please. I would like to start with some questions. Do you know any risk factor for oral cancer? Does anyone want to share the answer? Yes, no? Do you know any signs or symptoms of oral cancer? Let's move on to the next question. Do you know how to perform oral cancer screening? So what I'm going to share with you will be helpful for those who are familiar with oral cancer screening and those who are not. Next, please. Okay, what is oral cancer? It's malignant cells grow in the tissues of mouth or throat. It can affect lips, tongues, cheeks, gums, and other areas of the mouth. The risk factors are all forms of tobacco use. It means cigarettes, cigars, pipe, and chewing tobacco. Excessive alcohol consumption, try to be moderate when you drink it. It means 1 cup daily for women and no more than 2 cups daily for men. The sun exposure, because it increases the risk of lip cancer. That's why it's essential to use the sunscreen daily. Poor diet due to a lack of vitamins and minerals. Age and gender, because people over 45 have a higher risk. And with respect to gender, males have twice the risk as females. And the last risk factor is the poor oral health. Next, please. What is oral cancer screening? It is a visual and physical examination to detect early signs of cancer in the oral cavity of throat. It must be performed inside or outside of our mouth. It should be performed once a month for at least 3 minutes. The goals are to identify mouth cancer at an early stage, to treat it and obtain better results, develop preventive strategies and reduce the risk, because during the early stage, there is a greater chance for a cure, and definitely to save lives. How to reduce the risk? So quit smoking, it's very important. Reduce your alcohol intake. Wear sunscreen every day. Eat well and balanced. Practice good dental hygiene. Schedule regular dental checkups and perform a self-examination monthly. Now my friend Bahamna will continue.
Thank you, Olga. So, how abnormal findings may appear? We need to know that to identify when it is better to consult the doctor. Extraorally, we are looking for any lumps or bumps. Generally, these are not painful and doesn't move or stay for more than 2 to 3 weeks. Sometimes we can find lumps and bumps that moves and can be painful, because it could be something serious. If the lump or bump is little painful, moves and disappear within 2 to 3 weeks, it means our lymphatic nodules in our head and neck were helping our body fight with virus or an infection. I think it should be clear, or if there is any question regarding this, you can ask me. But do not panic if you find something. It could be nothing, but make sure you're alert about these signs. And now I will be showing you a video for the demonstration of self-oral cancer screening.
In this video, we will be covering the oral self-examination. This video is intended for both patients and healthcare providers and teaches how patients can perform an oral self-exam at home. First, make sure to wash your hands with soap and water before beginning. Perform an oral self-examination on a monthly basis after cleaning your teeth. Remember, this can save your life. Materials needed include a gauze and bright light or a well-lit room. First, examining outside of your mouth. Take a look at your scalp, head, and neck, checking for anything that looks different from your normal or that is asymmetric. Use your fingers to apply gentle pressure working down from your head and cheeks in front of your ears, checking for any areas of pain, lumps or bumps, irregularities in texture or color, or any other abnormalities. Use your fingers to feel for lumps or bumps in your neck and under your lower jaw. Next, examining inside of your mouth. Take a look at your lips. They should be uniform in color and texture. Feel both of your lips by rolling them between your index finger and thumb, noting any lesions, abnormal dryness, discoloration, or asymmetry. Lift your upper lip high and examine all the gums. Repeat for your lower lip. Open your mouth and pull your cheeks away, one side at a time with your finger to look inside. Look for any red or white patches. Use your finger in the cheek to check for ulcers, lumps, or tenderness, and repeat on the other side. Take a gauze or a tissue and gently pull out your tongue and look at the top, one side first and then the other, to see if any color changes or if any red or white lesions are present. Also, note if any other abnormal changes are present, such as any swelling, or if any wound takes too long to heal. Examine the underside of your tongue by lifting the tip of your tongue to the roof of your mouth, and then look underneath at the floor of your mouth for any changes that are unusual. By lifting your head back, look at the back and roof of your mouth to see if any bumps or growths are present. Also, note if any color changes are evident. Always visit the dentist on a regular basis. He or she will perform an oral cancer screening for you. If you notice any abnormal problems or if you're not sure, visit the dentist at once. Early detection is the key factor in treatment success. If any of the following symptoms are present, visit your dentist: difficulty in chewing or swallowing, a chronic sore throat or hoarse voice that does not heal, red or white patches in the mouth or on the tongue, a lump or overgrowth of tissue anywhere in the mouth, non-healing ulcer for more than 2 weeks. Thank you for learning with us.
Now I'm going to show you how to do your self oral cancer screening at home. If you wanted to do on yourself, then you have to wash your hands with soap and water. But if you do want to do it on your kids or on any of your family member, use gloves after washing with soap and water. When you are doing your extraoral cancer screening, then you have to do it starting from your forehead, just checking with your 2 fingers, checking for your lumps and bumps on the sides of your cheeks, in your neck, at the back of your neck, in your scalp, at the back of your ears, everywhere. If you find anything abnormal that is not usually on your face, on your head and neck. And if everything is fine, you're good to go. But if you find any abnormal findings, just visit your dentist. If you want to do it on your intraoral, and then can you see? It is, if you are doing at the roof of your mouth, just use your 2 fingers and press gently and see if you are finding anything abnormal. If we are doing underneath your tongue, then just press again under your tongue and see if you find anything abnormal. Use gauze for your tongue. Hold your tongue with the gauze and just turn it left and right and see if you can see any red patches or white patches or any lumps or bumps again. Use your fingers to check for any swellings or pain, and then just see if you have any abnormal findings. If these findings are just normally happening and they are healing on their own before 2 weeks, then that is not a concern. But if they are staying for more than 2 weeks, then visit your dentist. And you should always go for a oral cancer checkup. And after this, if you have any questions, you can ask to us. We will provide you a link for your survey that you can, if you have time, just go for it and tell us how this meeting was with us. We will be very glad to receive any feedback from your side. And thank you for attending the meeting. Thank you so much.